Hello, Dr. Richie. This is Jane Maragua, your psychopathology class student. Um, I'll be discussing about post-traumatic stress disorder. I chose this disorder because I just thought about the things that have been happening in our country lately. A lot of school shootings, theaters, veterans are returning and they have the PTSD symptoms because they were involved in war. We also have a lot of people that are doing really traumatizing actions that are affecting a lot of people. PTSD symptoms include being your life gets really affected by the really traumatizing event. The event may have happened to you. It could have happened to a loved one, a close family member, or it could have even happened to a close friends. And the trauma affects the person's quality of life. They keep recalling the trauma. They live it like it's happening on a daily basis. They have flashbacks of what happened. They have dreams. They keep dreaming about it. When they see things that remind them, the cues that remind them about the incident, they maybe get frightened, or they try to avoid anything that will remind them of the trauma. The people that also have PTSD, they have really distorted cognitions about themselves. They believe that they are not good people, they are to blame, they're guilty, and they think I am not good enough, I'm a bad person, and these things keep ringing in their heads, and it really affects their quality of life. PTSD patients also, they really feel like they don't want to socialize, they want to be on their own, they want to isolate themselves, they have a lot of anxiety, and they feel like maybe avoiding those things that can really be associated with the trauma, maybe their life will be better. So they don't even do well in their jobs because of the stress and the emotions. They also have suicidal ideation. They think that nobody likes me anymore, I don't think I need to live anymore, and these are things that really affect their quality of life. So as a result, they just don't feel like they really belong into anyone, to anything, they really don't have a good quality of life. PTSD people or patients, they need someone to really help them realize that they're not to blame. Even if they feel guilty, it was not their fault. They need to know that they are not bad people. So the treatment options that are available are, for example, the exposure therapy. That's kind of therapy that helps them to realize that it was not their fault, and they help them, instead of avoiding the trauma or anything that really reminds them of the trauma, they are able to really relieve the trauma, but in a safe manner. The therapist helps them to realize that here you are in my office, you're safe, be open, I'm here to listen, I can understand how you feel, and it was not your fault. They help them through slowly by slowly, so that they are able to learn that even if it happened, they can still have a good life. Exposure therapy is one of them. Because they have distorted cognition, the therapist can also help them realize that they're not bad people. They can still live a good life the way they think. It's not the way it should be, because things could have gone the way they did, but they can still live a good life. So cognitive behavioral therapy can be applied to help them change their way of thinking. The other therapy, the other treatment option that's also available for them is stress inoculation training, whereby because of the stress that they go through, they're able to help them learn even like communication, ways to communicate, ways to express their anger in a healthy way, ways in which they can team up with other people and connect, make connections, and these are things that will help them cope. There's also the trauma-focused cognitive behavioral therapy, which is mostly, especially those people who were abused, childhood abuse victims. They learn how to really learn how to cope without blaming themselves and knowing that it was not their fault. So they stop blaming themselves and they change the way they think about the trauma and be able to safely and comfortably relive it. Even if they will never forget what happened to them, they can still think about it, but in a more safer manner without really having stress, so much stress, and decreasing their quality of life. The eye movement desensitization reprocessing, EMDR, is also a good treatment method for people who have PTSD, because they're also able to really accept, move on, and live a quality life that even if the trauma happened, they can still have a good life. Thank you for listening. I hope I did well. Thank you.